Welcome to our newest episode of the Lebanese Physicians Podcast. And today we'll be talking about infection control with Dr. Lana Dbeibo, who I knew very well from my days at Indiana University. Lana actually is a graduate of the American University of Beirut Medical Center, and then she came to Indiana where she did her residency in internal medicine and fellowship in infectious diseases. And very quickly, she became involved in a lot of the initiatives at Indiana University, including becoming director of infection control at Methodist Hospital. And then when COVID hit, she was actually director of the vaccine initiatives for Indiana University during that period, where she did some great work and eventually received an Indianapolis Business Journal award for her work on vaccine initiatives in Indiana. And in addition to that, Lana is currently Vice Chair for Quality, Safety, and Population Health at Indiana University School of Medicine. Welcome, Lana, to the podcast.
Thank you so much for having me, Khalid.
So, Lana, can you tell us a bit about your how did you decide to start your residency at Indiana University and your move to IU and subsequently your decision to pursue infectious diseases?
Right. So, as you mentioned, I graduated from the American University of Beirut, and like many, I wanted to come train in the United States. And I came here to Indiana University in 2011. At that time, I didn't really know what kind of subspecialty I wanted to really do. I was more leaning towards gastroenterology, but when I first started, I was inspired by many leaders or by many physicians in infectious disease, and that's what probably started my interest there. And then, as every infectious disease physician will tell you, there's something about infectious disease that's very intriguing. That challenge, that diagnostics challenge, and that the interesting cases in ID is probably what drove me the most to doing that. So I decided to stay on and pursue fellowship there. And I stayed on as faculty. And during my fellowship, I thought I wanted to do lab work. So I worked on actually in the lab on drug development for resistant urinary tract infections. And after 2 years of that, I decided that it was probably not something that I was as passionate about as I thought I was. And I started another journey of searching for the career that I felt most passionate about, or the track within infectious disease. And, you get inspired by things that happen around you by just observing what happens in the hospital. And I was very interested in infection control for the sole purpose of trying to prevent harm. It was inconceivable for me to think that patients who come here to our hospitals, every healthcare system, to feel better and get comfort, that they would be inadvertently harmed. And from an infection perspective, they could get, catheter-associated infections or surgical site infections or ventilator-associated pneumonias. And this is where I thought, yes, I want to be involved in this work and improve the quality of care that we deliver to patients. And I was lucky because at the time there was an open position, and it was a big position, but I decided, you know what, I was not prepared, but I know that I can be. So I took on the role and I learned and tried to improve myself, and we can talk about that as I went in the role. So this is how my career started and where I am.
Yeah, I remember you took that role pretty quickly after finishing your fellowship, and it was a big role because Methodist is one of the bigger hospitals in the IU Health Network. So how has your work in infection control been at Methodist, I guess?
Yeah, so Methodist is the biggest hospital. It has over 600 beds in the system. So it's been great. I think this was an opportunity for me to, like I said, learn on the job. So my role involved a lot of leadership work because, as you know, with any quality improvement work, you have to engage people in the work that you do. So I, in addition to doing the work that I had to do, I was involved in training and educating myself in leadership. and in epidemiology. So I did a lot of courses in leadership. And I also enrolled in a master's in public health because my work is in hospital epidemiology and the hospital side. And of course, doing an MPH with a focus of epidemiology seemed to be the best thing for me to learn about the job. And then as I worked on a lot of the quality improvement projects to understanding the role of root cause analyses and implementing processes for improvement, I realized that, I needed some more training in implementation science. And that's when I took a certificate in the IU School of Medicine for implementation science. And I started applying everything that I was learning in real life as we went through the improvement projects at work. So it was a combination of learning from great mentors I had, in addition to trying to do personal development work on the side. And most of the things that we do in infection prevention is not discovering new knowledge, but really how do we implement in big systems like Methodist? And then how do we spread that knowledge to others, not only through publishing and research, but how do we spread it to other hospitals within IU Health? As you know, IU is a 17 hospital system, and we have joint meetings with many of these hospitals where we could share the knowledge so we can learn from others. And then this is where some of our protocols were also disseminated within IU Health. I'm also part of the Patient Safety Coalition for Indianapolis, and this is where all other non-IU Health hospital systems join as well. And this was actually very helpful during the pandemic, but even before and after, this was a good avenue for us to share the learnings. In infection prevention, because patients go from one hospital to the other, and between nursing facilities and back to hospitals, it's important to have this organized effort to try to prevent the spread of infections in hospitals. And that was part of my kind of public health, population health role as well.
And can you tell us about like one or two of the successes you've had in the directorship of infection control, like some things you've prevented or some initiatives that you've taken?
Yeah, so I'll tell you about the first ones because these ones you remember the most. And I will say that for the past few years, since I started, we've had over 50% reduction in hospital-acquired infections. And I know when I speak about I say me and my team and my colleagues who've been working hard day in and day out, even throughout the pandemic, to reduce that. But one of the first ones was reducing catheter-associated UTIs. And this was a unit that was historically at Methodist notorious for having the highest infection rate, and people had given up on trying any initiatives over there. So my first role was to bring people together so that they understand the why behind it. And as I mentioned, this is more about leadership and engagement than it is. The first stages are more about leadership and engagement than they are about quality improvement. Just bringing the right people to the table and explaining to them why it's important to focus some of their attention on that. And then once you hit that engagement piece, what we tried to do is we tried to create solutions together. So it wasn't a top-down approach. It wasn't I'm coming here as a director telling everyone what they're supposed to do. It was more of let's work together to find the solution. And that also increases engagement and their ability to comply more with the interventions that are going to be proposed, because it's coming as a team effort rather than as a top-down approach. So we discovered, based on the data analysis and the root cause analysis, that most of their infections are caused by really overculturing catheters that were colonized with bacteria, and there wasn't a clear indication, and patients were getting excessive antibiotics because of that. We went through, creating algorithms that were evidence-based. So creating a solution similar to a PDSA cycle. This is something I learned in my implementation science program. And then trying to implement that operationally within the unit. And that resulted in significant reduction in infections, really, and in antibiotic prescriptions. And we tried always in infection control and in quality improvement to look for unintended consequences as we go through those improvements. So we wanted to make sure we weren't causing harm by underdiagnosing infections or causing bacteremia. So we've monitored for that. And I think that increased people's confidence that we were doing the right things for the right reasons. And that intervention spread throughout the entire hospital system. Right now, it's being used everywhere. As an institution, we are in the top decile for catheter-associated UTIs in the nation. And I think these small projects that turn into big interventions are what I feel proud about the most, because they come from the units themselves, from the frontline workers themselves, and not from leadership or administration.
Right, exactly. Because it's not a top-down approach. You're working with the people on the units and showing them that things are improving. And I think once they see the improvements, they will get more excited to keep working.
Yes, and they engage with you on multiple different things. And every one of those operational protocols had to be adapted to different microcultures and different units. So the standard remains the same, but we wouldn't get into the nitty-gritty of how people operationalize some of the work, as long as there is a process and there's a measurement mechanism to make sure that we are doing the right things and that we are following unintended consequences as a result.
Right. And then during this whole process, the pandemic started.
Yes,
and
of course.
Can you tell us how it was, like the first month of the pandemic, like how you dealt with that, and how overwhelming? I bet it was very overwhelming. How overwhelming it was.
It was, and my hospital was because of its size and because it's the academic institution in the state of Indiana, was going to be one of the designated hospitals for COVID. So it was an overwhelming sense of responsibility to take care of patients appropriately. So do we have the capacity to take care of the patients? And how do we make decisions on triaging who needs to come to Methodist versus other hospitals? That was a big part of my role. But the big part also that was weighed heavily on me and a lot of my infection control colleagues everywhere around the world, I think, is rationing of PPE at times where we didn't have enough PPE, and how do we keep our healthcare workers safe? And, I remember, not to dramatize things, but I remember I was 7 months pregnant with my first child, and we were all very busy. We weren't sleeping the night. Things were just coming up continuously. And I was worried for my son. I mean, how that level of stress is going to affect him as he grows, because I couldn't control it. I could not control the anxiety that having to go through all of the literature and decide who gets to get the N95 and who doesn't get the N95. And even knowing that this is all evidence-based, just listening to people and hearing their concerns about taking the infection back to their kids and not feeling safe enough. It was very tough. So the way we went around this is really, from a healthcare worker safety perspective, we got the evidence and we worked based on our evidence, so that we can feel like it's not a subjective response to the pandemic, but just objective. And the other thing is we met with people regularly. And this is where the anxiety was, because you were hearing angry people, and you as a leader in a responsibility position, you have to accept that people are angry. And this is not on you to yell at them back. It's on you to absorb that anxiety and try to reduce it for them. So this was the toughest part, I think, of all of that, is seeing your colleagues suffer through it. But we tried to meet very regularly. Every time there was an email, we responded to it. And when I say we, me and the team that I work with, and also making sure that we're always updating them with the evidence. In terms of surge capacity, that was another thing that we, had to work through for patient safety. We developed protocols for how do we test patients before procedures, and how do we bring in the newest diagnostic, the fastest diagnostics, who gets the faster diagnostic, who gets the not as much rapid testing. And again, all these protocols were shared IU Health wide. They were created as a team, and they were shared as well with our coalition members, so that we're all in the community taking care of the patients together.
Excellent. Yeah, I mean, it was. I bet it was hard work, and initially there was a lot of unknowns, so
Yes,
it was very hard to convince people not to be anxious at that point in time.
right.
And then I guess the vaccines came out,
Yes.
and how did Indiana University approach you to take on the vaccine initiative?
Yeah, so I was initially approached from an infection prevention perspective, way before the vaccine, to be part of the medical response team for Indiana University School of Medicine. We have not School of Medicine, through the School of Medicine for the entire Indiana University. So Indiana University has around 9 to 10 campuses around the state, and most of them remained open throughout the pandemic. So my role, in addition to 3 other physician colleagues, and the public health side of IU, was to keep IU open as safely as possible. So we were creating protocols for testing teachers as well as students, and then creating contact tracing systems to make sure that we follow infections and prevent outbreaks. So I was responsible for the outbreak investigation control part for the university. And then as the pandemic went away, or as the vaccines came on, I should say, I got changed to that role, and my responsibility was to vaccinate IU basically for safer reopening. Again, we were opened in a limited perspective, and we just wanted to open up fully for all students. IU has 120,000 individuals between students and staff. So we had to set up large vaccination clinics, and that was part of my job, is to monitor that, is to develop the operation for those large clinics to vaccinate students, teachers, and then for the remote hospitals that are for the remote campuses, to collaborate with local health departments on getting access to the vaccines in the clinics that were already set up. At that time, the time when IU wanted me to do that was the time where vaccine was limited in supply. So we had to really work with the health department on getting a supply of vaccine and then distributing it and rationing it. And as part of our vaccination campaign, we opened up in one of our big campuses for the community. So we were able to also vaccinate members of the community in this operation. And I think that's what the community appreciated, the give back that IU gave to them by creating that vaccine clinic. I worked a lot on vaccine hesitancy and misinformation as well, and did a lot of town halls, both within our community as well as within the refugee community in Indianapolis, and did a lot of Arab American town halls as well to try to answer questions about the vaccinations. So this was really the scope of my role.
So was there a lot of people fighting back against taking the vaccine, I guess?
Within IU.
IU.
We had a vaccination rate of over 90%. We did have issues in the courts, obviously, at some point when the vaccine became a requirement, just like any other vaccine. Everyone who gets into university needs to have a list of vaccines, and when we added COVID to that, there were some issues that were fully resolved in the court, but most of the community was very accepting, and a lot of parents would send us notes that they feel like their children were safe in the environment that we created for them. So we had an over 90% vaccination rate, and of course we created exemptions based on medical or religious basis, I guess. But for the most part, people did not push back. We did have a ton of town halls that allowed us to answer people's questions as well about the vaccine. So I think that helped.
And I guess that probably, like the success of the campaign, probably pushed the community to maybe start getting vaccinated, I guess.
Right. And, we were lucky because at that time, the vaccine misinformation wasn't at its peak. So those were the times when everybody was excited about the vaccine. And I think we got lucky in the timing as well, because that was the time when everyone was over the pandemic and they wanted something to save them. And they were actually waiting in line to get the vaccine. And it wasn't really the other way around. The hesitancy, I think, started after we went through that huge population that was very willing to get the vaccine. But yes, at some point, the more people got the vaccine, the more comfortable your hesitant population became. And then they came in to get the vaccine. They did. And as usual, there's the early adopter and there is the
How many people do you know, like, do you have an approximate number of how many people in the community, in addition to the people in Indiana University, did you vaccinate?
Are vaccinated
Like, how many people in the
us?
community were vaccinated in the clinics?
I used to have that number, but it's thousands and thousands. It's not like a few hundred. It
was a big operation.
It was a very big operation. So it was in, Bloomington. So it was in IU Bloomington because Bloomington is the main campus. So it was the Monroe County clinic at some point. The health department was a part of that clinic for the most part.
And then after you did all of this, I guess you were approached by IBJ, right, for recognition, I guess. So how did that happen, and how did you know you were going to be recognized in the Indianapolis Business Journal?
Yeah, so this was a nomination that I knew later was from our dean and the president of IU Health. I was approached. I knew something was going on because I was asked by someone from the dean's office for my CV and a brief bio or something. So I knew something was up, but I didn't know it was IBJ 40 under 40. And I never imagined, I would get it. And then I just got an email that, all of a sudden you just got accepted for this award. And it was great. I think, of course, the award is great and it gives you something back to the work that you've done. It gives you some recognition. But because it was a recognition of my community service, I think this is where my the best thing about it is that it was about the community service that we provided for people during the pandemic, whether it was for the healthcare workers who worked at our institutions, or whether it was for the people who got the vaccine later on. I think that ability to impact people's lives in those tough times was something I was really proud of and was recognized by IBJ.
Congratulations on the recognition.
Thank you.
And I guess, can you give us some examples of other people who were recognized, just to tell people like who you were with in that recognition?
Yeah, so it's all people, like there are inventors, there are people. So IBJ is a business award. It's an Indianapolis Business Journal award. So it's really mostly an industry. People have done great things. And I was sitting there and I'm like, am I really in the right place? Like, what did I do? I didn't invent anything. I just contributed and did my job to the community, I guess. But a lot of people from industry and the business world, a lot of inventors, a lot of people who created startups out of nothing, really. And I was looking at myself and I'm like, I created this with a group of people who were extremely helpful and who raised me up. So I give back some of it to the team that worked with me. But yeah, some of these people were real entrepreneurs.
Yeah, I mean, you've done hard work. You saved a lot of lives, and it was a tough environment. I think you deserve that recognition. So my next question for you is how prepared do you think are we to deal with future pandemics? Because probably future pandemics are coming, and how prepared are we to deal with them?
So I think we learned a lot from this pandemic, a lot about our incident command structures. So on a local level, I think we've developed our incident command structures, our emergency management structures, and our collaboration strengthened a lot before the pandemic, and since the pandemic, and I see that even on the infection control side, when we collaborate with other institutions, there's definitely a new level of collaboration that we didn't have before. We also have avenues to prepare the public, that we weren't aware of or exposed to in the past. We are now aware of the fact that we need to prepare and train staff, even with the shortage that we are experiencing right now. We do recognize, so for example, we have a special pathogens unit at Methodist that's prepared to take care of emerging infections like viral hemorrhagic fevers and others, and we regularly do training of staff in preparation for this. And we've had enormous successes with diagnostics, therapeutics, and vaccines was probably the biggest success from this pandemic. So all that to say is we've also discovered a lot of gaps this pandemic created a lot of gaps that we need to fill. And I'm not a global health expert, but I think globally there needs to be more funding for public health in general, even in the United States. In a state like Indiana, we need a ton more funding, and I think we our governor has created a public health commission right after the pandemic to try to help with that. We need better collaboration between industry, WHO, and other health organizations to equitably distribute all of the resources everywhere. We still need a lot of help with that. I think surge capacity for all diagnostics, therapeutics, viral testing, viral research funding needs to be up. And then response to smaller outbreaks is also something that we need to focus on, like Ebola right now in Africa. It's something that we need to focus on. I think the biggest one is combating misinformation and vaccine hesitancy. And I think this is probably one area where we left the pandemic worse than when we got into it. Anti-vaccination campaigns have really surged, and they've widened the distance between science and people. People have less trust in public health institutions right now. They have less trust in vaccines. We saw an uptick of people, who've chronically been okay with flu vaccines, starting to submit requests for exemptions for flu vaccines after all of that. So I think from that regard, I worry that we are less prepared than we were before, even with the availability of more better technology for vaccines.
Yeah, I agree. I think that's one of the biggest things we need to fight over time.
Yeah.
And I know we talked about collaborations and stuff, and you're doing your master in public health at this point. So what are your future plans, I guess, after you finish your master's?
I don't know. I find myself not having these great 5 to 10 year plans, even though you see me taking on leadership positions right now. I am in quality and safety, so I'm expanding beyond IP to full-on quality and safety for the Department of Medicine at IU, because I am interested in quality improvement beyond just infections, really improving our system to better take care of our patients. So I don't have very long-term plans. I don't know if I will move from quality and safety at a local level to more of a population level state health department, or stay within my institution and work more on population health, so populations that we serve. I'm still undecided, but I think I'm trying to prepare myself for either by doing some of that training and by seizing, I guess, opportunities when I see them, with growing myself in more diverse ways than just infection control. So we'll see, but I'm excited about getting into that new field.
Yeah, great work, Lana. I mean, you've done so much great work over the past couple of years, 2 or 3 years, and that is at the same time that you've been able to have 2 beautiful kids who are still 2.5 and 1 year old. So it's a lot of hard work and raising 2 kids at the same time. So I would say congratulations.
Thank you. And I hope other people can see this as more of not a self-bragging, but as proof that we can make it if we try hard. And, definitely luck has a lot to do with it. Being in a system that is supportive, having teams that are great is crucial because you can never make it on your own. But yeah, I hope that people like us who immigrated and came to, a foreign country initially know that they can really make it if they have the will and determination to do it.
Yeah, thank you, Lana, for being with us on the podcast, and I hope people will learn about your journey and then about what needs to be done to fight pandemics in the future.
Yes, I hope so. Thank you so much for having me. It was great talking to you.
Thank you.